We are going to start what is treatment. So first one is what is treatment. You have to understand three main things about the treatment: what is treatment group, and what is treatment ID. So yesterday, as we discussed, so if there is a patient, okay, and this is a patient, and this is one more patient. Basically, you can consider it as a treatment arm or anything. So there are two groups of patients. This is first group, and this is second group. Okay, there are two groups of patients. This is first group, this is second group. See, why we do clinical trial is we compare two things. For example, you can take a active drug or a placebo drug or a test drug or a reference drug. So basically you compare two different drugs or two different treatments and elicit which is better, which is worse, which is more safe, which is more effective. We have to compare it. For comparison, we will have the at least there should be two treatment arms. This we call as experimental unit. This is one experimental unit and this is one experimental unit, and this experimental unit we call as treatment, and we give name to a treatment. For example, I can give this as a placebo arm or treatment arm or reference arm or reference treatment group. So the different names, the RT system should be flexible so that whatever the client wants to know about this or the client terminology, we should be able to insert into the system. So the name given to a particular treatment is known as treatment group, that we call as treatment group. And what is the treatment ID? So if we are giving a code to this ID, so rather than explaining it, this is a placebo arm, this is a treatment arm, this is a reference arm, I am giving that just a ID 1001 AD or something else, so which is not related to this treatment. I'm just giving a code, so that code is known as treatment ID. Treatment, experiment group, and treatment ID. So then we move on to the next thing. This is just an example. You can take this example as a treatment group. Test can be a treatment group, reference can be a treatment group, placebo can be a treatment group, and treatment ID can be 1301 100 AB. So this should be a combination of alphanumeric combination. So this is the just an example for treatment group and treatment ID.
Clingenius Research.